You know, what if I told you that a heart attack doesn't always strike like a bolt of lightning? What if your body was actually trying to warn you, not just for a few moments, but for weeks before it happens? Today, we're going to decode those critical early signals. And honestly, this is the kind of stuff that could literally save a life.
So, let's start with what we all think we know. We've seen it in movies 100 times, right? The sudden, dramatic, out-of-nowhere heart attack. But is that really how it works? Well, for a whole lot of people, the answer is a surprising and pretty loud no.
And here it is, the key insight. As experts like Dr. Alok Kumar point out, our bodies often send up warning flares weeks, not minutes, in advance. So what's the problem? The problem is we mistake these life-or-death signals for, well, for everyday annoyances. A little bit of indigestion, maybe a pulled muscle, or just feeling totally wiped out from a busy week. Okay, so let's dive into this prelude to a heart attack. Because really, the biggest mistake any of us can make is just brushing off these quiet, early signs. Understanding what they are and why they're happening is your first line of defense.
I mean, think about it. It's so easy to do, right? You get a little burning in your chest and blame it on that spicy lunch. Or you feel out of breath and just chalk it up to being out of shape. We're all busy. It's easy to explain away feeling tired. But what if it's not a minor thing? What if it's your body sounding a massive alarm? So, what exactly are we looking for here? Let's break down the 5 most common early warning signs. You can think of these as the alarm bells your body is ringing, trying desperately to get your attention.
5. There are 5 of them, and I'm telling you, committing these 5 signs to memory could be one of the most important things you ever do for your health or for someone you love. So let's get into them.
First up, chest discomfort. And we really have to get that movie heart attack image out of our heads. It's almost never that sharp stabbing pain. It's much more likely to feel like a persistent pressure, a squeezing sensation, kind of like a heavy weight is just sitting right on your chest.
Okay, the second sign is what we call radiating pain. This feeling doesn't always just stay put in your chest. A lot of the time, it travels. Typically, it'll start in the chest and then move out towards the left arm. But, it can also show up in your neck, your shoulders, or even your jaw.
Sign number 3 is a huge one, and that's breaking into a cold sweat for absolutely no reason. So you're not exercising, it's not hot outside, but all of a sudden you just feel clammy and sweaty. That is a major, major red flag that your body is under a ton of stress. Next up, sign number 4, shortness of breath. And again, we're not talking about being winded after running a 5K. This is feeling completely out of breath after doing something really simple, like walking up a single flight of stairs or carrying in the groceries. It's a really clear signal that your heart is struggling to do its job. And finally, sign number 5, nausea, indigestion, or even vomiting. Now, these symptoms are actually particularly common in women, and they are so easy to mistake for a stomach bug or maybe just something you ate. It's a really crucial sign not to overlook. Okay, so recognizing the signs, that's step 1, and it's huge. But what you do next, that's what's absolutely critical. And this brings us to a concept called the golden hour, which is all about shifting from just recognizing the problem to taking immediate life-saving action.
The golden hour is pretty much what it sounds like. It's the first 60 minutes from when those major symptoms really start. Getting professional medical help inside this window, it dramatically increases your chances of survival, and it can seriously reduce the amount of damage to your heart muscle. In this situation, time is everything.
So what's the play? Here are the steps. If that chest discomfort lasts for more than 15 minutes and it's not getting better with rest, you treat it like an emergency. You get to a hospital right away. On the way there, chew one 300 milligram aspirin tablet. But please, remember this, that's first aid. It's not a cure. It's no substitute for getting to a doctor fast.
All right, so we've covered the warning signs and the emergency plan. Now let's shift gears and talk about what we can all do every single day. Because when it comes to heart health, the best way to survive a heart attack is to never have one in the first place. Let's start with diet. And look, it doesn't have to be super complicated. The big idea is just to limit your salt, your sugar, and those refined oils. Even simple swaps, like using mustard oil or olive oil instead, in moderation of course, can make a huge difference over time. Next, you gotta move. Your heart is a muscle, and just like any other muscle, it needs a workout. A brisk 30-minute walk every day is one of the best and safest things you can do. Things like cycling and swimming are fantastic for strengthening your heart, and even certain types of yoga can help you manage your blood pressure.
But a quick word of caution here, and this is important.
if you're thinking about starting something really intense, like heavy weightlifting, please talk to your doctor first. That goes double if you have any pre-existing health issues. You have to put safety first.
And finally, you have to be proactive. You have to take charge. Find ways to manage your stress. Even something as simple as deep breathing exercises can help. And if you're over 35, make sure you're getting regular checkups, at least once a year. That means knowing your blood pressure and getting a lipid profile, which is just a simple blood test for your cholesterol. You have to know your numbers.
So we've gone through the signs, the emergency plan, and the ways to prevent problems in the first place. The power here is really in your hands. This is all about taking conscious, active control of your health and the future of your heart.
I'd like to leave you with this idea. Your heart is literally the engine that powers your entire life. It works non-stop for you, 24/7. So the least we can do is learn to listen to its voice, to those quiet signs and whispers, and do what we can to keep that engine running strong. So, I'll just leave you with this one question. It's not about some big, grand plan for next year or even next month. What is one small thing you will do for your heart today? Thanks so much for joining this explainer.